as interest in NMN, nicotinamide mononucleotide, expands from cellular rejuvenation into therapeutic strategies for metabolic aging and obesity, the crucial question arises: how safe and effective is long-term NMN supplementation when used specifically to activate autophagy and combat age-related fat accumulation? While NMN has shown immense promise in preclinical studies, particularly in restoring NAD levels, enhancing mitochondrial turnover, and activating autophagy in liver, muscle, adipose tissue, and even the brain, the translation to clinical use demands careful evaluation of dosing strategies, therapeutic windows, biomarker-guided adjustments, and potential long-term risks. Current data on NMN's safety profile are encouraging. Short and medium-term studies in both animals and humans have reported minimal adverse effects. In murine models, even high doses of NMN, up to 500 milligrams per kilogram per day, over several months have not produced toxicological red flags. In human trials, daily oral doses ranging from 250 milligrams to 1,200 milligrams for periods of up to 12 weeks have been well tolerated. No clinically significant elevations in liver enzymes, kidney markers, cardiovascular strain, or oxidative damage have been reported. These early trials, though relatively short, suggest a wide safety margin, especially at modest doses. However, they do not yet resolve the question of what happens with continuous use over years, particularly in older or metabolically compromised individuals. In terms of efficacy, NMN's anti-obesity potential hinges on its capacity to restore autophagic flux and mitochondrial homeostasis, particularly in tissues prone to dysfunction with age. In both lean and obese aged mice, NMN improves markers of autophagy, e.g., increased LC3-2 and decreased P62, enhances mitophagy, and results in reduced fat mass, especially visceral fat, while preserving lean body mass. These effects are dose-dependent to a degree but appear to plateau at higher doses, suggesting a threshold beyond which additional NMN may not confer additional benefit. In humans, although robust weight loss trials are still lacking, preliminary findings suggest NMN can improve insulin sensitivity and muscle bioenergetics, hinting at downstream metabolic effects consistent with autophagy enhancement. Defining the optimal NMN dose for autophagic activation in aging obesity will require balancing efficacy with long-term tolerance. Preclinical evidence points to a bell-shaped response curve. Low doses may be insufficient to trigger cellular remodeling, while excessively high doses may saturate NAD synthesis pathways or induce compensatory downregulation of autophagy-related genes. In human terms, a daily oral dose of 250 to 500 milligrams seems to activate sirtuin pathways and support mitochondrial biogenesis without adverse effects. For targeting autophagy specifically, intermittent or pulsatile dosing may prove more effective than continuous exposure, mimicking natural stress response cycles like fasting or exercise. Indeed, autophagy is inherently a cyclical process, not meant to be active at full intensity continuously. Chronic, unregulated autophagic activation could theoretically impair cellular homeostasis, especially in tissues where turnover needs to be tightly controlled, such as neurons or cardiac myocytes. Thus, protocols that incorporate periodic NMN dosing, e.g., 5 days on, 2 days off, or combine NMN with natural autophagy cues like time-restricted eating may optimize outcomes. This cycling approach could help sustain responsiveness, avoid potential downregulation of NAD, biosynthetic pathways, and align with the body's circadian and metabolic rhythms. In terms of cofactors and synergistic agents, NMN's efficacy in promoting autophagy may be enhanced when combined with lifestyle or pharmacologic interventions that modulate the same cellular pathways. Caloric restriction, intermittent fasting, and compounds like resveratrol, spermidine, or metformin all activate overlapping cascades, e.g., AMPK, SIRT1, and TOR inhibition. Strategic pairing of NMN with such agents may allow for lower dosing and more sustainable benefits, especially in populations at risk of both obesity and frailty. However, potential drug-nutrient interactions need to be studied carefully, as overactivation of autophagy could lead to unintended consequences in sensitive individuals. Long-term considerations must also address changes in NAD homeostasis with aging. Over time, chronic inflammation and CD38 upregulation accelerate NAD degradation, potentially undermining the efficacy of NMN therapy unless co-administered with CD38 inhibitors or paired with anti-inflammatory strategies. Moreover, the NAD autophagy axis plays roles in DNA repair, immune signaling, and stem cell maintenance, systems where dysregulation could either accelerate aging or provoke compensatory stress responses if pushed too far. Therefore, while NMN appears safe and effective at supporting autophagic renewal and metabolic improvement over the short to medium term, long-term protocols must include periodic monitoring of biomarkers such as NAD levels, LC3-2, P62, mitochondrial DNA copy number, FGF21, and metabolic indices like HOMA-IR and lipid panels. Adjustments to dose, frequency, or compound cycling can then be made based on individual responses. Ideally, future protocols will be personalized, guided by genetic markers, e.g., sirtuin expression polymorphisms, metabolic status, and age-related cellular profiles. In sum, NMN represents a promising and relatively safe agent to target autophagy dysfunction in aging-related obesity. Its ability to restore cellular self-cleaning and energy balance makes it a strong candidate for long-term metabolic support, particularly in populations with limited ability to engage in exercise or caloric restriction. Yet, as with any powerful intervention, optimal results will depend on thoughtful dosing, biomarker-guided adjustments, and an awareness of the delicate balance between cellular stress signaling and regeneration. With continued research and refinement, NMN could become a central pillar in future anti-obesity and longevity strategies tailored to the aging population.